herpes, gonorrhea, syphilis, AIDS. Now, I'm sure you've all heard of these diseases before, but one disease that does not get the same public attention is candidiasis. Now, you may be asking yourself, what is candidiasis? Well, I asked some fellow IU students that question, and this is what I got.
I have no clue.
Some disorder involving health. I have no clue.
Is it a viral infection?
So as you can see, if you don't know what candidiasis is, you're not alone. Let me teach you about this STI. Candidiasis is a fungal infection that can affect areas such as the skin, the throat, the blood, the mouth, and the genitals. Candidiasis is caused by an overgrowth of a yeast called Candida. This is already present in human bodies. If the fungal infection occurs in the mouth or throat region, it's called thrush. And if it occurs in the genitals, it's called a yeast infection. If it occurs in the blood, it's called invasive candidiasis, or candidemia. Now that we've established that there's thrush and a yeast infection, let's talk about the difference. Thrush usually occurs in infants, the elderly, patients getting chemotherapy, AIDS patients, and patients suffering from other diseases that cause them to have a weakened immune system. The characteristics of thrush are white spots in the mouth or tongue, soreness or discomfort in the throat with difficulty swallowing, or redness, discomfort in the mouth, and also cracking where the lips meet at the corners of the mouth. So let's talk about a yeast infection now. Vaginal yeast infections have extreme itching in the vaginal area, a soreness and redness in the vagina, white clumpy vaginal discharge, and painful intercourse. Penile yeast infections are characteristic by red rashes on the penis, itching and burning on the tip of the penis, and also painful intercourse. You can get a penile yeast infection passed on from a vaginal yeast infection, sort of like a UTI. Last is the invasive yeast infection, when it gets into your bloodstream. You're most likely to get this infection if you're in the hospital, in the intensive care unit, had a recent surgery, have a catheter in place, or have a weakened immune system. It can be difficult to know which symptoms are related to candidiasis because of the fact that those infected are also already sick, but it can vary depending on which part of the body is infected. The common symptoms overall are fever and chills that don't improve after antibiotics since it is a fungal infection. And it can develop if the infection spreads to other parts of the bodies, like the heart, brain, bones, and joints. So now that you know the difference between thrush and yeast infection, let's talk about the treatment options. So now that we know what candidiasis is, let's talk about treating it. There are many antifungal medications available for treating candidiasis. Treatment can last from between 1 to 7 days, depending on the severity of the yeast infection. Medication may come in vaginal suppositories or oral pills. The oral pills, for mild to moderate infections, may actually make the infection go away within 1 day. There is an 80% to 90% success rate of many over-the-counter medications. So you can see a lot more women going to CVS like this and getting the over-the-counter medications, diagnosing themselves. What's very important to see is that you don't take too much, or else you'll build up a resistance. If you build up a resistance, then there will be too many yeast cells and they won't be destroyed by the medication. Diagnosing yourself for yeast infections is good, but you shouldn't take too much medication. The dangers of not getting a yeast infection treated are that it could get worse, there will be a lot of itching, pain during intercourse, and even you could spread a yeast infection to your sexual partner. Well, women should note that there is a difference between a UTI and a yeast infection. Although the symptoms may be very similar with itching and discomfort, you should know the difference because the treatment for both is different. So now hopefully after watching this video, you know what a yeast infection is, what thrush is, and how to treat it if you ever get it. Careful, because yeast infections are dangerous during pregnancy as the antifungal medications could be tied to a miscarriage risk in recent news. Thank you for watching. Stay safe. Don't be silly. Wrap your willy.